Dear students, welcome to Bluepen Online. Shall we begin? Please use headset, pen and paper to take notes.
Here you go. Please let's know your feedback after class.
Now, what is osteomyelitis? What's osteomyelitis? Okay, you can actually shift this. Okay, you can actually split this term into three: osteo, okay, mylos, and itis. Itis. Osteo means what? You all know that osteo means bone, right? Osteo means bone. What is mylos? This means marrow. Okay, I'm sorry, marrow. Then, itis. It's, what does that mean? That means inflammation. So in short, osteomyelitis means what? Bone, marrow, inflammation. Is that clear? So that's what is known as osteomyelitis. To define osteomyelitis, we have a very good definition given here. That is the inflammatory condition of the bone which begins as infection of the medullary cavity and Haversian systems, extending to involve the periosteum of the affected area. Okay, before reading this particular definition, it's very important for you to bring the picture of the anatomy of bone into your mind. Okay, what it is, you will have a marrow cavity to the center, then you have the Walkman canals, you have Haversian canals, then you have interstitial lamina, the spongy bone, the combat bone. I hope you remember this from your first year anatomy. So please bring that picture in your mind. Now read this. Inflammatory condition, bone, which begins as infection of the medullary cavity and Haversian systems, extending to involve what? Periosteum of the affected area. So to classify osteomyelitis, we have suppurative and non-suppurative osteomyelitis. Suppurative and a non-suppurative one. That's clear, right? Then you can also classify it as acute and chronic. Okay, and suppurative type of osteomyelitis, you can have acute suppurative. Okay, acute suppurative. Then you can have chronic suppurative. You can also have infantile type. Okay, in non-suppurative, we have chronic sclerosing, which can be focal or diffuse. Okay, then you can have gady sclerosing, then actinomycotic type of osteomyelitis. Okay, this actinomycotic, tuberculous osteomyelitis, then syphilitic osteomyelitis. These all are some specific types. Okay, specific type of chronic osteomyelitis. Okay, then radiation osteomyelitis and necrosis, that we will see as a separate topic as it is very important. Okay, now what are the predisposing factors for this osteomyelitis? One thing is the virulence of microorganisms for sure. Let us see which all organisms are involved in it, and the virulence really affected, right? Then the conditions affecting host resistance, like what? Diabetes, malnutrition, severe anemia, chronic alcoholism, right? These all can affect. Okay, now the conditions that affect the jaw vascularity, like radiation, if the patient is undergoing a radiation therapy, or the patient is having osteoporosis, already having osteoporosis, or any kind of bone malignancy, these all are some predisposing factors. Then the etiology and the pathogenesis of osteomyelitis. So the focus of infection, mostly in most of the cases, the focus of infection can be pulpal or periodontal. Okay, or it can be because of some trauma. In case of compound fractures, you know what are compound fractures, right? If not, please refer our fracture chapter. I'll be dealing with the important fracture topics there. Okay, then periosteoitis following gingival ulceration. In some cases, this gingival ulceration can become so deep and involve the periosteum, right? So periosteoitis, which follows the gingival ulceration, or can be from lymph nodes also. Okay, then hematogenous spread in long bones. That can be an etiology. Osteomyelitis in maxilla is very less frequent. Why? Maxilla is having extensive blood supply when you compare it with the mandible. That is the reason why the maxilla is less prone to get this deadly disease. I would really love to call it as a deadly disease, because this is kind of a devastating or a destroying. This is having a very destroying character. It can destroy that complete area. So yeah, okay. Now the mandibular involvement frequency, introducing odorous, body, anterior arch, angle, ramus and condyle. Condyle is the last thing to get affected. Okay. Then what? The process that is leading to osteomyelitis, how it happens. First thing, definitely there will be an inflammation. So this is actually given in your OMR textbook. Please refer to your OMR textbook and then have a look at this. Okay. So for the first thing is an acute inflammation. Definitely there will be an inflammation. An inflammation can only lead to this problem, right? So initially there will be an inflammation. From that there will be hyperemia. When there is hyperemia, there will be increased capillary permeability in that area. Okay. This actually leads to infiltration of granulocytes into that area. Okay. Now the proteolytic enzymes are there. These enzymes cause tissue necrosis. So when there is tissue necrosis, there will be necrotic tissue. Along with that, there will be dead bacteria. Okay. Within WBCs accumulates in that area. And here what happens, the intramedullary pressure increases. This results in the vascular collapse. Venous stasis will be there. Venous stasis means what? There will be blockage in the flow. Then that can result in ischemia. Ischemia means what? Deprival of oxygen. Okay. Now what happens? Pus travels through the Haversian nutrient canals and they accumulate beneath the periosteum. If this is the periosteum, the pus starts to accumulate here beneath the periosteum. Okay.